I'd like to welcome Minister O'Gorman to the House and thank you, Minister, for coming in yourself to take this important matter. I've raised a matter seeking clarity as to the status of early years services. Early years and childcare providers are, as you know, Minister, very concerned about the lack of clarity and lack of certainty around their position. And I've been, in recent days and weeks, engaging extensively with providers, with those involved in the SIP Too Big Start campaign, and of course with Shas Suas, who communicated with all Oireachtas members yesterday seeking clarity on the reopening, the full reopening of the sector, and asking what public health criteria will be used to enable them to reopen fully. And of course childcare providers, as we're all aware, are now in their fourth week, I think, of offering services on a reduced basis to the children of essential workers. I know that many are deeply concerned about their safety in their work environment, and there are also issues clearly around not operating at full capacity in terms of funding and resources. Indeed, a survey by the Federation of Early Childhood Providers found that of 706 early years and childcare services that participated and that were open since the 4th of January on this reduced basis, 14% had a positive COVID-19 case, resulting in either the closure of pods or of the full service, and that 67% of their members indicated that staff were uncomfortable attending work as they feel unsafe in their work environment. So clearly, we know there is a Cabinet decision due today. We understand that further lockdown is likely until the 5th of March. And in that context, where you have childcare providers providing a service, where you staff going into work every day and providing this essential service, they are entitled to have greater clarity. One of the issues that's been raised with me further is about vaccine rollout, about where childcare staff will be in the prioritisation list for those receiving vaccines. And that's clearly also a real matter of grave concern. We know from the SIP Too Big Start campaign that as many of 79% of early years professionals do not have access to sick pay. So there are multiple issues for those working in the sector, and of course for those of us who are parents, and clearly for child safety too. And I would just say, Minister, in the context where the government appears to believe it's not practical to introduce an aggressive suppression strategy as Labour has sought, including mandatory hotel quarantine, it's extraordinary to me that we're facing months more potentially of children being denied return to school, of creches and childcare providers not being able to open fully, of children requiring additional education, still facing this level of uncertainty, and businesses remaining closed. And yet it's not practical to enforce the rules on non-essential travel. I looked at the arrivals in Dublin Airport and departures. There's flights going out to Lanzarote every day from Dublin Airport this week, and it's extraordinary to me that that could be classed as essential travel. I'm glad to see government are going to implement stronger enforcement of these rules, but we in Labour have called for an aggressive suppression strategy, and I think that's clearly what people want and what we need as a country to try and keep our transmission rates, to reduce our transmission rates first, and then to keep them low, because we know about this uncertainty with vaccine rollout and timing, and it's clear that we're going to need a longer term strategy than government appears prepared to take. So I'm very disappointed about that, and I think that's an important context within which childcare providers deserve greater clarity and assurance on reopening. Gurmagat.
Thank you, Senator Batchik, and welcome to Minister O'Gorman. You have 4 minutes.
Thank you, Chair, and thank you, Senator, for raising this important issue. And I suppose just at the outset, I do want to acknowledge the fact that even in the level 5 situation that we're in at the moment, and particularly since January, childcare providers, childcare professionals have continued to provide childcare services and school-age childcare for the children of essential workers, but also the vulnerable children as well, and that's a hugely important support in the economy. It didn't happen in the major lockdown last March, and I really want to express my gratitude to the entire sector for all that they're doing. And the Senator, you'll know yourself that early learning and care and school-age childcare services, which are providing this childcare to the children of essential workers and to vulnerable children, they are fully funded by the state through all the existing departmental funding schemes. So this is the ECHE scheme, NCS, CCSP and TEC, whether children are attending or not. Now currently, where services are closed due to the fact that they have the permission of the department, and that includes all services that delivers the ECHE scheme and other services for which there is no demand for the service from eligible parents, they are also receiving full subsidies from all of those schemes. As regards the public health advice, That continues to be that it is not necessary to close preschool or childcare services due to a risk of COVID-19. The reason that ECHE has been closed is part of the general effort to reduce movement across the community, not because there is any risk to either the children or the childcare professionals working in those services. However, it is important to acknowledge, and I think it's something that we all do acknowledge, no environment is without risk of COVID-19. And in order to reduce and in order to mitigate that risk, we have a very detailed set of guidelines for the childcare sectors, and I know they've been implemented with great rigour across the sector since May of last year. Just this year, between the 1st and the 15th of November, there have been 85 notifications of COVID been present in a childcare service, and it's important to note that not all COVID-19 cases in a service will result in either the full closure or a pod closure. Where there's evidence of a confirmed case was in a service during the infectious period, the HSE works with the service provider to decide what are the measures that need to be taken. The HSE has informed my department that to date in 2021, less than 5 childcare services have been directed to fully close due to COVID-19. You raised the issue of both vaccination and the issue of testing, and my department has been engaging rigorously with the Department of Health on the issue of vaccination. Right now, ELC and SAC staff are priority 11 for vaccination, and this means they're prioritised ahead of people aged 55 to 64 in other occupations important to the functioning of society. And obviously, we have an allocation strategy that has evidence base to it. Where that evidence base changed, I'll certainly be advocating on behalf of this sector. Over 1,800 childcare services are currently open and are providing childcare to the children of essential workers and to vulnerable children. They all continue to receive the full range of departmental funding streams. Services which are closed with the permission of the department also receive the full subsidies. Services which are currently closed with permission includes the 1,500 ECHE only services and 800 services that have received force majeure permission. Services that are directed to close for public health due to COVID-19 will also receive force majeure funding, and childcare providers which have no demand for childcare from eligible parents will also can also apply for force majeure funding on a weekly basis. All childcare services continue to get the EWSS, which makes up to about 50% of their total funding. And just finally, Chair, the Sustainability Fund is also there for services that don't have that have sustainability issues.
Thank you, Minister. Senator Batchik, you have 1 minute to respond.
Just briefly, thank you, Minister. I know you didn't address the broader issue, but I do thank you for the comprehensive response on the specific issues I raised around childcare. I should say I'm still advised there are difficulties for some services meeting operational costs, and there was a concern that they would not be able to recoup funding where they were unable to open due to staffing issues. So I'm glad you've provided some clarity on that, and I would like to engage further with you on the future COVID-19 Sustainability Fund, which you mentioned and which I think you say will soon apply. So services facing financial difficulties will soon be able to apply for that. So that's certainly welcome. I know you say less than 5 services are fully closed, but certainly the survey indicates that there's been a higher rate of cases resulting in perhaps closure of pods within services. So I think that remains a matter of concern. But I would like to finish, as you have done, by acknowledging the vital work of those who are continuing to provide this hugely essential service throughout the pandemic, and to say that I'll continue to advocate on their behalf, and I look forward to further engagement with you on this issue.
Thank you, Minister. We're tied for time. 1 minute.
Thanks very much, Senator. I suppose there has been a rigorous engagement between my department and the sector over the last number of weeks, and particularly since the higher level 5 restrictions were introduced. We've had 8 meetings of the Childcare Advisory Group where representatives come in and meet with my department. I've attended 7 of those 8 meetings myself because I know this is a difficult time for providers. We're continuing to work with providers and the wider group, so obviously SIP2 is part of that group as well, representing childcare professionals to make sure that we can keep the sector sustainable, make sure we can keep it open for the parents of essential workers and for vulnerable children as well. And we'll be continuing to work and develop schemes that keep that funding in the sector at the moment, but also address those sustainability issues, because different childcare services have different funding streams, and funding comes from different areas. Some are more reliant on parental fees, and we will be addressing these issues in the near future.